This is Precision, Perspectives on Children's Surgery from Anne and Robert H. Lurie Children's Hospital of Chicago. I'm your host, Erin Spain. On this podcast, we introduce you to surgeons at one of the country's most renowned children's hospitals to find out how they're transforming pediatric medicine. Today, we are taking you inside the Epilepsy Center at Anne and Robert H. Lurie Children's Hospital of Chicago, one of the most advanced pediatric epilepsy programs in the country. Each year, more than 2,200 children from around the world come here for expert multidisciplinary care, from state-of-the-art video EEG monitoring to specialized clinics and advanced epilepsy surgery. Recognized as a Level 4 epilepsy center by the National Association of Epilepsy Centers, this nationally prominent program doesn't just treat epilepsy, it helps children live fuller lives, supporting their medical, emotional, and developmental needs well into adulthood. To find out more about this special program, we're talking today with Dr. David Bieber, a pediatric epilepsy specialist and director of the Clinical Neurophysiology program at Lurie Children's. Welcome to the show, Dr. Bieber.
Thank you.
Well, let's start with a little bit about you. I would love to know what led you to pediatric epilepsy specifically. And then can you tell us a little bit about neurophysiology? This might be a field some of our listeners are not that familiar with.
So I actually went into medical school wanting to be an adult cardiologist, and I hated it, with a passion. And I set up my whole, medical school career for cardiology at first, and then I had all my pediatrics at the end. One thing led to another. I started to realize how much I loved epilepsy specifically. I knew I liked neurology, and then it was epilepsy as I went through. I was just fascinated by this field. I liked working with children. I found it very rewarding because I felt like I could do a lot more than I could with adult cardiology and have a bigger impact on people's lives because I could help them earlier in their life. When I work with children, I feel like I am able to help them make choices now that will benefit them for the rest of their lives. And I just find so much satisfaction in being able to be part of those decisions that might help significantly improve the rest of their life. So that's how I landed in neurology. So I am a clinical neurophysiologist technically, which means I did a couple of years of pediatrics residency, then 3 years of general neurology with a focus in children. And then I decided I liked this neurophysiology, which is essentially the study of the physiology of different parts of the nervous system. Clinical neurophys technically covers EEG, which is brain waves, EMG, which is peripheral nerves and muscles and how they work. There's sleep medicine, that's part of it. Intraoperative monitoring. So we monitor the nervous system, like the spine during surgery. And so I decided I wanted to go into that because it just had broad applications on what I could do with a focus, though, on EEG and epilepsy. And I ended up just realizing I just want to see epilepsy patients. My particular area of interest is devices. So you can implant devices either in the brain or in the neck that can help control seizures, that use little electrical stimulators to help stop seizures.
You mentioned this is a population that you can really help with treatments. Was that what the motivating factor was, why you wanted to work specifically with epilepsy patients?
I will say the moment that I realized it is when I was reading a stereotactic EEG in training, which is essentially when we put electrodes using a fancy robot to put electrodes actually into the brain or onto the brain for epilepsy surgery. And when I saw what you could do with that, it's really truly the only cure for epilepsy in those who don't outgrow their epilepsy, is when I realized that this could be so impactful in people's lives, and I wanted to learn more and get better at that specifically. And so that's when I changed everything for what I was doing to go towards epilepsy, because I really am fascinated in working with children who could benefit from epilepsy surgery.
Tell me about what it is that you do within the Epilepsy Center, and what makes you motivated to come to work every day and work with this population of children?
I find a lot of joy in being part of patient and family care team. I like to be a partner in helping families navigate the complex world that is epilepsy. And I've always had a passion actually for understanding what a test means for the person sitting in front of me. Because even though I say this all the time, a lot of our tests give you an objective number. It is an objective test, but a lot of what medicine is the interpretation of that objective data and applying it in a helpful way to the person children who needs it. And the simple way to think of that is those are biomarkers, so just markers of what your body is doing and how do you use that information to help the person in front of you and interpret that, which is why I kind of landed in this stereo EEG, epilepsy surgery, neuromodulation, is because I was fascinated by all of this new information that was coming out. And there remains a ton of questions out there about what do each of these results mean and how do we use that data and how do we use these new tools that we know work, but how do we use them effectively for the person in front of us?
Talk about that sort of relationship building and how you approach each case.
The best answer I have for you is honesty. I want to be an open, honest partner in this relationship that is the provider-patient relationship. Even if sometimes that is difficult, it's better to be honest than try and sugarcoat anything or say it in a way to manage how somebody might respond. It's better to just be very upfront and honest about both what we know and sometimes what we don't know.
People come from all over the world, really, to Lurie Children's and the Epilepsy Center. It's often described as one of the most advanced in the nation. So let's talk about that a little bit. What makes this program unique?
It's those that don't respond to the first medication that get referred to us. And there are so many things about the program here. Some are unique, some are not. Like any level 4 epilepsy center should have ability to do complex epilepsy surgery, which is not unique to us, but because we see a pretty high volume and we have a good group of epilepsy providers and neurosurgeons and radiologists who are comfortable and regularly work with children with epilepsy that could benefit from surgery. Just having all that exposure does make us unique. I will also say that aside from epilepsy surgery, we have one of the biggest ketogenic diet centers in the country, which is where children's epilepsy can be treated with diet. And we have a whole dietitian group, 4 dietitians, actually I think 5 now, who will see patients for ketogenic diet referral. And so that is definitely a unique aspect of our program. We also were one of the first epilepsy programs to have a school liaison who can help children and families navigate the complex world that is having epilepsy and navigating school and lots of aspects of day-to-day life.
You mentioned the school, for example. This is something that's very unique to children and adolescents. What are some of the other ways that you're specifically meeting those unique developmental and emotional needs of this age group?
My previous mentor when I was in training said epilepsy is really a lot more than just seizures. Epilepsy, the diagnosis is those who are at risk for unprovoked seizures, but there are a lot of psychosocial, emotional, cognitive side effects that come with the diagnosis. It has one of the highest burden of stress with a chronic disorder. It's very comorbid with psychiatric disorders like anxiety, depression, ADHD. And so our center is very much built around that idea, more than just having physicians and nurse practitioners to care for seizures. We do have an embedded neuropsychologist who helps with cognitive concerns, behavioral concerns that can go along with epilepsy. We also partner with psychiatry. We have a psychiatrist who helps see our patients with epilepsy to help with behavior problems, anxiety, depression, ADHD, medications that can help with that, also referrals for therapists who can help. And we have social workers who also help with any supports that families might need. There's a lot of challenges sometimes with our specialized, very specific, unique medications that can be very hard to get that our social workers can help families. And epilepsy is more common in those in lower socioeconomic brackets. So our social workers are very good at helping navigate some of the systems that are out there to help families get access to help for their children.
Can you just take us through what that journey is like for a family from the moment they're referred and they walk through the door until, they're getting the treatments and the ongoing care?
I would say the journey is probably a lot bigger before they get here. So I'll just make reference to that because it's a well-established problem in the epilepsy world that sometimes it can take years for children to get the correct diagnosis because it might start with a seizure and they get referred to primary care or emergency departments. Not all seizures look the same, and sometimes they can be misdiagnosed. It can take up to 2 years for children, if not longer, to find their way to a center that can actually help them, that would be best to help them, such as our epilepsy center. Once you're through the door, it seems a lot more straightforward because we have a dedicated admin team who helps families with setting up appointments and schedules calls, and we have nurses who help with all the questions and phone calls and meets them initially when they come to a visit to go through all the basics, and then they'll see their epilepsy provider who will help navigate what tests they might need. And so once you're in the epilepsy center, there are all these people that can help. It's really the journey to get here that can be a big problem.
You mentioned all these different players on the team that come together to provide care. Give us a little behind the scenes. I mean, it may look pretty straightforward from the patient and family standpoint, but there's a lot going on behind the scenes to really design the best treatment plan. Is that right?
Oh my gosh, yes. That is absolutely true. I mean, just today I've been on the phone all over the place trying to sort out some things for some patients. There are a lot of moving parts to any patient's care. Families will obviously feel this too. They have a lot of things that they have to navigate themselves, and then we do our best to help them. And we do a lot of things like care conferences. Almost all epilepsy centers will have like a surgical conference where our radiologists, neurosurgeons, psychiatrists, psychologists, epileptologists all meet together to talk about patients who could go through surgery. But we also have weekly multidisciplinary meetings with just our epilepsy center folks, which is actually really focused on everything other than seizures in the patients. So it's run much more by our social workers, psychiatrists, psychologists to talk about just day-to-day life problems that some of our patients might be going through. And we also have a Monday meeting where we talk about complex EEGs for some of our patients and get lots of different opinions from different members on the team. So that's just the surface of it. Then our nurses are always behind the scenes, contacting families, doing forms, everything that's needed for school, sports, you name it. There always seems to be something for epilepsy patients that need doing.
Well, let's talk about some of the outcomes that you've seen, not just medically, but in the quality of life for children who've undergone some of these epilepsy surgeries at Lurie Children's. Can you just tell me about some of the transformations that you've seen?
Some of the best ones are those that suffered from frequent seizures and after treatment, and particularly epilepsy surgery, because that is really some of the most effective epilepsy treatment there is for those who are candidates for it. Go from multiple seizures a day to no seizures for multiple years after I've met them. Not everybody will have such a dramatic response. Some patients, the reality with genetic disorders or some of the very complex epilepsy syndromes, it may be hard to completely get control of seizures, but I've been pretty proud to work on a few cases where we've been able to at least reduce seizure burden, particularly some of the worst daytime seizures as far as like drop seizures where kids may fall and have to wear helmets or they might knock out teeth. But we get to the point where those types of burdensome seizures are under control. And the most memorable one I have recently, watching somebody be able to go to graduation when before they were not sure they were going to be able to because their seizures were so frequent and they weren't sure if they were going to be able to make it because of just their burden of seizures, and they didn't want to be there and have a seizure. And they got to the point where their seizures were so infrequent, they felt comfortable to be able to go to high school graduation. Even though our goal is always no seizures and no side effects, even if we can't quite make that goal, we can absolutely have a beneficial impact on just day-to-day quality of life by using all these tools at our disposal to individualize care for some of these patients.
You're very interested in innovation and new devices and also research. So, can you talk to me a little bit about that? What role does innovation and research play in the program?
We do these electrical stimulators, which is my area of interest, and they range from vagal nerve stimulators, which is kind of the oldest device, and a little device that goes under the skin that connects to the vagus nerve in the neck. So it's not a brain surgery, but it's under neurosurgery, to devices that actually get implanted into the brain, and we can program them to send out electrical stimulation based off of all sorts of different parameters. And the ones that people might think of is there's some good photos out there from the past about this technology used in movement disorders. So it was a violinist who was playing a violin during the surgery while the surgeons were standing behind the violinist and were adjusting the implant to stop the tremor in the hand. We use kind of a similar type of technology to implant electrodes into where seizures might be coming from. And even though we can't adjust it right in the operating room for seizures because seizures are unpredictable, but it is a more effective treatment than medication sometimes for patients to undergo these procedures that with these implanted devices that we adjust their programming. This area has a lot of need for improvement, and it's my personal area of interest.
What draws you and your interest to these devices and improving them?
I like technology, and these definitely fall into the hybrid of bionics, which is human machine interface type things. And what really got me fascinated by these is the data out there right now. It's definitely like a frontier of how to use these devices effectively. It is very hard right now to know which device is best for which patient and what program is best for which patient, depending on their epilepsy, age, like causes of their seizures, frequency of seizures. What are the best parameters and devices to use? Really, I see that as an individualization of this technology per person. Like, we do have these big groups of data, but it's really hard sometimes to apply that data to the patient sitting in front of you. And my area that I would really like to focus on in the future is helping guide families and providers all over the world to pick the best option for the patient sitting in front of them. And so that is something that we are working on slowly. It is complicated, but we use the data that we get back from these devices, particularly the ones that are implanted in the brain. We can look at brain waves and electrical information in and around where the electrodes are to try and tailor treatment for the patient sitting in front of us. Because right now, sometimes just like the journey to get to epilepsy, it can take a little while to find the right treatment protocol per patient. And I would love to be able to say 5 years from now, oh, we see this pattern on the EEG. If we were on the electrode, electrical potentials near the electrode, that we just set it to this parameter and we know that that is going to be more effective than this generic protocol that we have right now.
So you're really talking about more personalized medicine in this
Exactly.
space. Yeah.
Yep.
You mentioned that there are certain populations that have more cases of epilepsy than others, including some underserved communities. And this isn't just in the US, it's around the world. So can you talk to me a little bit about some of the work that you and other folks at Lurie Children's are doing to address this problem? The fact that there are underserved communities, children with epilepsy, who are not receiving the care that they should be receiving.
I will have to give a lot of credit to Dr. Sandy Lamb. She is the one who inspired me to get on this road, particularly working with this group in Uganda. It's a pediatric hospital where they do neurologic and neurosurgical care. We've done a lot of work on building a program there, teaching the team and providing education and resources for the team to be able to work up and evaluate patients there rather than us just saying, do this, do that, and we'll come and do the surgery. It's been very much a let's all work together just like we do here, where we act as kind of more like consultants. And we have helped a lot with the teaching for them to do. Actually, EEGs are almost as good as they are here. They're very high quality and their interpretation skills have significantly improved, where actually at this point where sometimes when I talk with them and they present cases, it's just like, yeah, I have nothing to add. You guys have it under control. And then we have done one trip so far where we do have to go hands-on, particularly from a neurosurgery perspective, to go and do some of the actual teaching and work on some of the cases. So we have gone and done a few epilepsy surgery cases there and gone to do some teaching. So it's been a great experience to see just this program grow and kind of stand on its own 2 feet.
It seems like there's a lot going on right now in innovation and in global health. What's your vision for the future? What would you like to see happen in pediatric epilepsy care in the next 5 to 10 years?
The 2 biggest things for me are access to the care. Some of the most frustrating situations are when this could have been helped earlier to help longer term outcomes, getting education out there to understand that these options are out there for patients, because the sooner you can get control of epilepsy, the better the outcomes are, whether it's cognitive, emotional, or seizure burden after epilepsy surgery are all improved the sooner that you can get them the appropriate treatment. So I think that's a big one. And obviously my personal interest is very individualized care. Like, how do we use some of all of this grouped data to be able to apply it in some of these newest tools? How do we do a better job of making sure that we apply it properly to the right person early on?
For new families who are coming for the first time to the center, what message would you like to leave them with? What would you like to say to them personally?
I'll be here for you if you need anything. So if you think of anything, feel free to give us a call and we'll help figure it out together.
Dr. David Bieber, thank you so much for being on the show.
It was my pleasure. Thanks for having me.
For more information, including how to make a referral or an appointment, visit luriechildrens.org.